Hello and welcome to Bottom Line. The world's largest vaccination drive is all set to start tomorrow. Prime Minister Narendra Modi will launch the COVID vaccine drive at 10:30 a.m. tomorrow by addressing as many as 3,006 vaccination sites across the country via video conferencing. In the Northeast, vaccination drive will be carried out across 65 centers in Assam and at around 10 centers each in other states in the region, including Meghalaya, Manipur, Nagaland, Arunachal Pradesh and other states. The stage thus is set for the rollout with all preparations in place, and the wait for the big day will be over in a few hours from now. But as we embark on the massive vaccination process, what are the challenges ahead? Is there a need again? Is there a need again for another awareness as far as the vaccine is concerned? Of course, at the later stages, because tomorrow, starting tomorrow, health workers, frontline workers, mostly health workers, doctors, nurses, technicians, health workers, they will be vaccinated starting tomorrow. But yes, of late, post the rollout of the vaccine, there has been a bit of a skepticism. So is there a need for a renewed awareness program on that front? So basically, what are the challenges ahead as India embarks on the biggest vaccination process? To discuss this matter, I have got an esteemed group of panelists with me today. Principal Secretary Health Meghalaya Sampath Kumar joins me from Shillong. Shyamsundar Singh, Dr. P. Shyamsundar Singh, Director of Health and Family Welfare, joins me from Imphal. Also joining me from Imphal is Dr. S. Jugindra. Dr. S. Jugindra is again the medical superintendent of Shija Hospital. Dr. S. Jugindra from Kohima. I'll be joined by Dr. Ritu Thur, who is the state the officer in charge for the COVID vaccination drive, state program officer for COVID-19. Ritu Thur will be joining me from Kohima, and Dr. Nobujyoti Gogoi, SDMHO Dibrugarh, is joining me from Dibrugarh. Also, Dr. Bhupen Mahanta, Associate Professor Medicine, joins me from Assam Medical College and Hospital from Dibrugarh. Dr. Prakritish Bora, Director Axel Care Hospitals, joins me from Guwahati. So that's quite a big panel there. Thank you all of you so much, gentlemen, for sparing on time, your time on such a busy day as we are all set for the big moment tomorrow. If I can quickly go to Mr. Sampath Kumar, Principal Secretary Health Meghalaya first. Mr. Sampath Kumar, all set, all the preparations in place, stage all set for the crucial vaccination drive tomorrow, sir?
Yes, we're all set. In fact, tomorrow morning we are going to start the launch in the state in 10 sites across the state, and the main site would be the Nigrims.
And how many frontline workers are you targeting to vaccinate in the first phase? What is the estimated number for tomorrow, for day one? Mr. Kumar, Sampath Kumar.
Yeah, day one we would be vaccinating around 1,000, close to 1,000. Because we have 10 sites. In each site we are expecting that around 100 healthcare workers would be vaccinated. So we have line listed, and all their data is actually uploaded in an application called CoWIN application, and we have a total about 27,000 healthcare workers are there in the state. Along with the state, we also have this, both with the central government and also the state government. A large number are from the state government. And there are also, the healthcare workers within the defense forces. So they also would be vaccinated by the respective defense, authorities. So that's the kind of a program that basically we have. So we've trained all our vaccinators and made these vaccination sites ready for vaccination. So it's a very a rigorous exercise. It's like a election exercise. The way we do, we prepare the polling booths. We have prepared these vaccination sites with clear demarcation of the roles and responsibilities of each of the functionary who is actually at the vaccination site. So So there is a space for, like a waiting space and registration and then vaccination space. And then after that there is an observation room. So after the vaccination, everyone has to wait for 30 minutes, and that's again just to observe, like they're all okay, and then after that they will be sent. So all these vaccinators are given the rigorous training, how actually to do this. In fact, we also have a lot of experience in the vaccination. It's like any other vaccination program only. It's only that, like we are doing it for the COVID related thing. So we have a special care in terms of ensuring that social distancing at the sites, and also ensuring that, like making sure that, like everything is actually very systematic, and people also are given a proper messages, because we also are going to use this entire vaccination exercise to educate the people, especially educate all the people who undergo this program, vaccination. So we also would like to use this exercise to educate them about the need for continuing those health protocols. There is a, because even like there is a first dose and there is a second dose, and after the second dose, after 14 days of the second dose, the vaccination would be effective. So people have to take all the the measures that actually the health protocols, to make sure that, like they follow those things very meticulously, and participate in this program. So that's, and we also have had media sensitization workshops, and and also with a workshop with the faith-based leaders, to explain to them about the entire vaccination program, and to give them the necessary confidence, public confidence that is required for for active participation of everyone. So we are starting with healthcare workers, and after that we are going to have the frontline workers. That includes the police and municipal workers, and disaster management and other revenue officials. So that's the second phase, and the third phase is for the people who are above 50 years, and and those with the comorbid conditions.
All right.
So that these are the high risk groups. That's why actually the entire vaccination has been actually rolled out. In fact, it's across the country, not only in Meghalaya, in this systematic manner.
Absolutely. Yeah. Dr. P. Shyamsundar Singh, Director Health, Manipur. So, big day tomorrow. Is the state all set to launch the COVID vaccine drive?
We are launching this at 10 session sites. The first will be launched by our Honorable Chief Minister, Shri N. Biren Singh, which will be followed by launching by the Deputy Commissioners there at the district headquarters, and those chosen sites, of which we have 10 altogether.
8,476 health workers are set to be vaccinated in the first phase in Manipur. Are they upbeat about the entire process?
Yeah, we are now ready. The only thing is that the number has gone up a bit, a little, because of this constant uploading from these sites. But then the original figure we gave was the one you just said, and now it has gone up a little because of subsequent uploading.
Absolutely.
No issue.
Absolutely no issues, I am sure. The preparations are already there. What are the key challenges, if any, you have identified in carrying out this vaccination drive starting tomorrow?
I do not see any major challenges coming up, as luckily we already had performed this dry run quite successfully, and then the 5-member team who will be deployed at the session site, they have already had enough experience from the dry run, and therefore I do not think there will be major issues. Maybe yes, there are small problems, like for example taking time while uploading by vaccination officer 2, for example. It may be, to start with, a little time consuming, but then as the process goes on, we believe that all those things will be smoothened, and then will be sailing very smoothly.
If I can quickly go to Dr. Ritu Thur in Nagaland, Kohima. Dr. Thur, is the stage, same question, is the stage all set for the big vaccination drive in Nagaland tomorrow?
Yes, everything is ready. Ground reality, all the necessary requirements are already in place. We are eagerly waiting for the rollout.
Eagerly waiting for the rollout. How many beneficiaries are you targeting in the first phase? How many people rather?
We have identified around 119 session sites, approximate around for the first tomorrow inaugural session, we are targeting around 500 beneficiaries.
500. Are all preparations in place after the dry runs being conducted? Are we expecting this to be a smooth process?
Yeah, absolutely. We are in the positive side. All the preparations are as per the Government of India the guidelines, and our health workers, vaccinators, all the multidisciplinary teams to be participated in the vaccination side. They are well trained. So all the information has been, hands-out training has been imparted in all the team. So we are in a readiness, eagerness to carry out the activities with a positive knowledge.
Absolutely, absolutely. If I can go to Dr. Navajyoti Gogoi in Dibrugarh. Dr. Gogoi, stage all set, big day tomorrow. Well, the vaccine is finally here and people will get vaccinated. Are we expecting a smooth process?
Yes, definitely we are expecting a very smooth process and we are ready for it. But considering the situation, there has been long awaited vaccine and a lot of people are eagerly waiting for it. Considering the situation we had, if we think about the situation when we had in August, September and October, those were the dangerous time, the way the people were dying and the way the people were suffering. And considering that, the good time has come now. We are very positive about it. Our trial run has been very successful and we are going to have 2 centers tomorrow where 200 people will be vaccinated. And we are all ready and most of the senior doctors are going in for vaccination tomorrow just to show the solidarity. And this is a safe vaccine, we can carry it out. And this is just another vaccine. We are taking it this way. We have been giving so many vaccines for years and we are very experienced enough and people don't have to worry about it. And just take us into faith. We're going to carry out it very nicely.
Absolutely. Dr. S. Jugindra, the MS Medical Superintendent, Shija Hospital, Imphal. Sir, Shija Hospital is the only private hospital in Manipur where the vaccination drive will be carried out. Are all arrangements in place?
Yeah, I must thank the government of Manipur to select Shija hospitals as the only private institute for vaccination for COVID, and it is starting in the first phase itself. We have the maximum number of health workers in a private sector in Manipur, and that is the reason why I think the government has chosen. And also that from the beginning of COVID infection and spread in Manipur, Shija has been taking part in all very many ways to tackle the problem and to treat the patients, to create ICU beds and all other facilities. So I think that is the reason why the government, and we are very thankful to the government for giving this opportunity. We have identified 1,200 healthcare givers in Shija hospitals who will be vaccinated starting tomorrow for the next probably 15 or 16 days, where we will complete this vaccination, and then we will go on to get the second dose. We have prepared everything. We are prepared for all eventualities. I hope that there will not be any serious events which will be telling badly on the vaccination, but we are prepared. Whatever the situation, we are prepared to the limit that we will, if there is any dire situation, we will call out a code. We will call out a code color I will not be announcing the code color here because we don't want the people around the hospital or in the vicinity of the vaccination area to be frightened because of a bad event that is happening because of vaccination. But we will call out a certain code which we have all the healthcare workers for emergency. We know the number, color of that code now, and as soon as we announce that, everything is in place. All people for the next 16 days of vaccination that is going to happen, we know who is going to be available at what time for what situation. So all that preparation is ready for us, and I think we will not need all the worst situation care that is required, but we are prepared.
So it has been a very, very elaborate process, isn't it, for the last few weeks, the dry runs, very elaborate, and are the health workers, the staff of your hospital upbeat about the entire vaccination process? Dr. Jugindra.
Yes, we are. Tomorrow it's the Managing Director, Dr. Palin, will be the first person to receive it.
Oh.
I myself, as the medical superintendent, will be the second person to receive it.
Great.
This is to boost our staff members, all our healthcare workers that are working in the hospital, to tell them that this is going to be safe. And we have our senior physicians and consultants who will be vaccinated first on the first day itself, so that in the subsequent days other staff and other healthcare givers, they are not afraid of getting this vaccination done. So we are prepared like that, and I think everybody is anticipating good results with this vaccination, and we are upbeat, and we are looking forward to this vaccination, and which will solve the problem. Maybe it will take another 1.5 months to be effectively showing us results that it is not causing excessive infection, because the immunity that will develop it will take some time. It will take 1.5 months or more probably, but we are anticipating for a very good results after this vaccination.
Absolutely. Dr. Bhupen Mohanto, Dr. Mohanto, great gesture as we see there from the senior doctors in each of the hospitals, even in Assam, in Guwahati, in GMCH. We have senior doctors, prominent doctors in fact in Assam and Guwahati taking the vaccine first. We just heard Dr. Jugindra, MS, Shija Hospital, Manipur. He himself will be taking the vaccine tomorrow. So that is a very great, good gesture, and much required maybe after all the reports of probably the vaccine not being 100% safe surfacing for the last week or so, which had in a way created a bit of confusion in the minds of the general people. Dr. Mohanto.
Yeah, it's very true. Based on the phase 1 and phase 2 trial, the vaccine is absolutely safe. So we have information about the phase 3 advanced phase 3 trial on Covaxin, and also phase 2 and 3 information about the Covishield. So both the vaccines are safe, considering this phase 1 and phase 2 trial and information about the ongoing phase 3 trial. So even in medical college, Assam Medical College, the principal, vice principal, the superintendent, senior retired teachers of the medical college will be the beneficiaries for tomorrow's program. And always, whenever we start any vaccination program in the country, I myself was involved in the Zai vaccination a decade back in Dibrugarh.
Okay.
So we were the first person. I was the first person to get the vaccine, because we had to face our own community, because everybody was saying that whether you will give the vaccine to your children or not.
Okay.
The Zai vaccine was meant for the children. So then we had to say that we took the vaccine. I have given vaccine.
So you were the first in the district to take that
person.
vaccination.
Right,
okay,
right.
that's quite interesting. Yes, go on, carry on.
Then
yeah.
I get the injection to my wife as well as my children. And next day onwards, we started telling that we have already taken the vaccination. And I took the vaccination twice in the first phase because of this reason. So these problems will always be there. But we have a stringent mechanism in the DCGI, that is the Drug Controller General of India. We have a statutory body, and the ICMR is involved. These are all technical. The skill committees and informations are already gathered. Based on that only, in case of pandemic situation, a vaccine is usually advocated or accepted for giving to the population. With phase 1 and phase 2 trial, already we have the safety. We know that this is safe. Only thing that we do not know the exact amount of immunogenicity is also known. But the actual how much protection will be offered with the vaccination will be determined from the phase 3 trial once it is completed. But these two vaccines already in the advanced stage of phase 3 trial. So I have enough faith on this particular vaccine. And already informations are coming that the vaccine efficacy is more than 60%. This is sufficient. And government is planning to give 2 doses at a gap of 2 to 4 weeks time. So once we can vaccinate the frontline workers, then subsequently the population who are, at high risk, definitely it will be a successful program as I personally feel for it.
Absolutely, should be a successful program. Dr. Navajyoti Gogoi, if we talk about Assam, of course, the most populated state in the northeast, and almost 10 to 20 times more health workers than there are in other states. So clearly a huge number, but things look very organized and very planned at the moment, isn't it?
Not exactly is that. The thing is that not in huge number. What we need here, the difference is that we need to follow the COVID protocol. And there are newer things that registers, online registration, proof, and whole procedure. There's a procedure in place which was not familiar to us earlier. And that's been already practiced very nicely, and people have geared up for all that. And all in all, the vaccine is, this is just another vaccine, I told you. Anything that people, those who are scared of, that might be having reactions, this, that, and a lot of things that scares, that should not be. I sincerely hope so. There should not be. The media will have to play a very big role in it here. And people are anxious. People are very anxious about the vaccine because the vaccine has been brought out in a very emergency way. And even then, the scientists for so long have been carrying out a very big task. We'll have to salute them first, those who have brought out these vaccines. We need a lot of vaccines. We got 4 or 5 vaccines. We need much more than and many other vaccines too. If we look around the whole world, if you want to vaccinate everybody. So that's why we need a lot more vaccines. We need to encourage them. We need to encourage the scientists, those who are working on it. And they have done a very commendable service by making it a very successful trial. They have given whatever the first and second trial had been conducted very successfully. And there's no hiccups. As far as I know, I had been in touch with a lot of people regarding this. I've been reading journals and all that. The knowledge I could acquire that this is a very safe vaccine, and this is the time. This is the need of the time. We must vaccinate people so that we don't want to see any of our near dear ones dying in COVID-19. My word, I'm telling you that it will be a big success we can carry out. Of course, it will take a little bit of time. For a vaccine, probably 1 or 2 years, we'll have to complete it. And that's the big task which we'll have to carry on. The way we are planning, not always, we are not going to vaccinate, we're not going to disturb our regular programs. We are having it on a 4 days a week.
Absolutely.
So on Wednesdays, vaccination day, other vaccines will be carrying on. And on Sundays, we are not conducting this. Only 4 days a week we are conducting. And if we need the cooperation from the public, you need the cooperation from the other sectors, everyone will have to have a very good atmosphere of vaccination. We need help, and for that help, we need people to get educated. Please educate yourself, be scientific, have a very scientific thinking, and this is what has been taught by COVID at present. And otherwise, without science, without research, without researchers, those who are doing this commendable service, this humankind cannot survive in this world. This time it is COVID, never know, God forbid.
Absolutely.
Nothing comes out again, and we need to improve our system. We need to improve our production. we really need to gear up this science, medical science,
For now,
so that it can meet more worse scenarios than COVID-19 in future.
For now, we should be doubly sure that the vaccine is safe. That is the message that is coming across. Very quickly, Dr. Jugindra.
Oh, yes, definitely. There has been proof there.
Yeah. Dr. Jugindra, you just informed us that you will be among the people who would be taking the vaccine in the first lot tomorrow when the COVID vaccine drive is launched. Was there a conscious decision? Was there a conscious decision from the top doctors in Shija Hospital, the only private hospital in Manipur where the COVID vaccine drive is being carried out? Was there a conscious decision so as to build the confidence of not just the health workers? The health workers are more aware. They are the more aware lot. Maybe the general public in the second and third phase, when we call upon the general public to come to take the vaccine, probably then we can give these examples with top doctors, known physicians coming out to take the vaccine the first.
Yes, very true. We have taken this decision consciously, and also keeping in mind that our decisions, our actions is going to be impressive, making an impression on the minds of the general public. As a doctor, knowing the science of the vaccination and the medicines that is going to be used, we are aware of the situation, and so if we do not come forward and take the vaccination, how will the general public be able to do that? That is the basic question that we have. So we just to show that this is necessary, we should do it, and as doctors, among the healthcare workers, again, we want that the doctors will come forward first, because they are the ones who will be knowing more, and they will be able to impress the general public more. And also amongst them, the prominent doctors in the state, in the particular state, so that people can be confident that if doctors can take it, why can't we? Because they will be having that idea that doctors knowingly are doing it, so why can't we? If they should be knowing what is going to happen, and that is why they are taking it, so why can't we? So that is the message that we want to give, and I hope that this will happen in that manner.
Absolutely. We'll have to slip into a very, very short break here. Stay tuned, lot more coming up on the other side. Welcome back. You're watching Bottom Line. We're discussing the COVID vaccine rollout. We'll go back to Dr. Jugindra once again in Imphal. Dr. Jugindra, do you think for phase 2, phase 3, of course, phase 1 starts tomorrow. There's still some time, a month or two or more before the other phases start. But again, mass awareness drive will be necessary to drive home the point once again that the vaccine should be and can be taken by everyone.
Yes, mass awareness will be required, and it will be done. Even during this vaccination program itself, we are intending to do that by communicating with the media. The media people will be there, and in each of the centers, and they will be collecting videos and data also, and that will be sent out to the public, and that way mass awareness program will be definitely necessary, and it will be done, and that should prime the second phase of vaccination, so that public are aware as to the methodology, how the process goes, how the people come and how they are vaccinated, then how they are kept in observation, and if there is any situation where further treatment or further management is required, how it is done. All these things will be available for the next phase. So since all these things can be, we will have the data as well as visuals for all these events that will happen, it will be easier for the next phase, and mass awareness will become much easier, and it will happen. I think it will be in a good manner. It will spread to the people of the region, and people will be successfully getting vaccinated and save themselves from this disease.
Absolutely. Mr. Sampath Kumar, what is the mood like among the health workers ahead of the vaccination? Is it upbeat? Are people looking forward to getting vaccinated? Have you been able to get a sense of that? Why I'm asking this, because we've been discussing this now, because there have been a lot of questions that there have been some questions rather raised on the safety of the vaccines in the run-up to the drive. But the Union Health Ministry and experts have reassured that the vaccines are 200% safe. Also, it's not a target-based thing, right? More than the numbers that we vaccinate each day, it is a smooth progress of the entire process that probably matters more in this case, Mr. Sampath.
Yeah, that is correct. Actually, in fact, you are right. Basically, that's why this lot of rigorous exercises have been done. So we have 2 dry runs before this exercise. So essentially, it's like a mock drill kind of a thing. So and then there is and also the initial dose was for the healthcare workers, and they know the importance of the immunization, vaccination at this point of time. This is a pandemic, and this is something that these vaccines are are immunogenic, and they are approved vaccines, and they're immunogenic. Immunogenic means they can produce antibodies to fight the coronavirus. So it's very important that you have this vaccine to protect from the coronavirus, because coronavirus is very infectious, highly transmissible, and invisible. So in fact, to contain the COVID, this coronavirus, the vaccine would prove to be very effective and beneficial for people at large. So the healthcare workers are really looking forward to it. In fact, there is a there is a as you said, we are going to do it a very systematic manner. The number, as you said, it's not exactly 100. It is essentially it is following that entire process. I said proper registration, vaccination, observation, and this entire process will be followed systematically. Definitely that's why we also actually are going to spread this vaccination program very systematically. One after another. Yeah.
Dr. Nobujyoti Gogoi, do you think in the run-up to the vaccine drive, the focus has been too much on what you call quote-unquote adverse events following immunization? I mean, too much of the vaccine may not be safe. Of course, I do admit the media has had a role to play in that, but media gathers reports from what is being said. We don't create our own reports, but there has been a talk. But as we embark on the vaccination process tomorrow, what we are seeing, what we have witnessed to senior doctors coming out to get themselves vaccinated first, I mean, that should put that theory to rest, right?
That's a very important question you've asked. You see, first of all, vaccine, there are so many vaccines. Some vaccines are 90%, some vaccines are 95%, some vaccines are, they're saying 70% or 60%, 65% effective. And on top of that, nothing is 100% safe in medicine. There may be, we cannot say 100 to 200% safe, but there never know, there will be some minor side effects or maybe some serious side effects, 1 in lakhs, very rare. Those are very rare conditions. And for that, what we have already have the system placed. Whatever vaccination in each and every Wednesday's vaccination of a state, our sisters are well equipped with a AFI kit. That kit, everything is there, right from adrenaline and Dexona injections and all sorts of, they can combat the first stage, they can combat any reactions, whatever it happens. And we have faced such instances earlier also. We have got through many experiences during H1N1 vaccination, swine flu vaccination, during encephalitis vaccination. And there were minor side effects. They have been recovering very well. And we are capable, our staff, our field workers are capable of handling it. And this time we are taking it more, we are trying to make it doubly sure that we can combat any sorts of reaction even if it occur. Very unlikely, probably will not be having, hope so, will not be having any side effects. There will be minor side effects, say headache and sorts of mild fever.
Absolutely.
Or maybe a myalgia, body ache. This might happen. About 5 to 6% of the people, those who are vaccinated. So there is nothing to worry about.
Okay.
We are making a system placed on. We are registering them. Everybody will be monitoring them. There is a system placed for monitoring. We'll be giving them calls if they have any problem. They can contact us 24/7 all the time, so that we can attend their problems. Any sorts of problem arises, and these will be recorded and it will be documented for the future vaccination program. So I assure the people of Assam, and I think it's a safe vaccine. Whatever it says, the government has planned it very nicely. The system has been placed so nicely so that we do have all records on each and every person that will be monitored throughout this year. And that will be a big task for us. Okay, we'll give 100% for it.
Dr. Mohanto, Dr. Bhupen Mohanto, as Dr. Gogoi mentioned, and it's well known, every time you take a vaccine or even a normal injection, there can be some side effects which is known. Even a tetanus injection may cause fever in some individuals, as we know. So it is very important that awareness is there, especially when we move towards the second phase. Right now, okay, we are vaccinating the health workers, doctors, who are the more aware lot. As we move slowly to the second and third phase, it is very important, the awareness part, so that people do not overreact once vaccinated. That is very important because that may create an undesirable situation, isn't it?
Right, very true. Yes, already the government is planned accordingly, and the proper training of the healthcare provider, those will be involved in the vaccination program, is already there. And with this first phase, many things will also be known to the healthcare provider. And because the that the vaccine is definitely safe, because our own people who are working as a healthcare provider are getting the vaccines. So from tomorrow, there will be a message to the community that when the healthcare provider can take the vaccine, why not we? So I hope that all the public will come forward, and the media houses will definitely send the informations in the correct manner, that based on the technical knowledge, the vaccine is safe and immunogenicity is already there. And with the subsequent vaccination program, we'll also know in detail about the subsequent complications if there is any. So based on the phase 1 and 2 trial, very limited number of side effects were observed. So safety, there is no question about it. As you have rightly mentioned, any injectable preparation, any vaccination program is related, can be involved with some kind of complications. But we need not have to worry for it, because every team will be equipped with all kind of facilities to manage mild to moderate to severe complications if any will arise. So I hope that these situations will be taken care of by the individual, responsible for the vaccination program. So people should not worry for that, but everybody should come forward to get the vaccines once it is provided by the government.
And very quickly, just digressing a bit here from the issue of vaccination. When the go-ahead was given, of course, to the vaccines that we know, there was a certain section, this is a bit political, but I'm asking you because you have been studying the subject closely, Dr. Mohanto. Questions were being raised on it. It was made to feel that the government in a way bulldozed its way with certain vaccines, which probably is not possible, isn't it, with such strict protocols and norms in place. It is not possible for the government of the day to bulldoze its way, and how the entire issue was being politicized. I'm sure those allegations and those concerns shouldn't arise anymore post tomorrow.
Very true. So I was involved in 2-3 randomized control trial in Assam Medical College. These trials were international, multinational, and these clinical trials, whether it is vaccine or any drug-related trials, are very stringent in nature, very closely monitored by the statutory body under the control of DCGI. So whenever any drug or any vaccine or anything is permitted in any country, I'm talking about India. So I have personally attended conference of Indian Society of, there's a research committee, ICAR, so last year. So this is year personally he attended the conference. He mentioned that we should develop our own programs. Drug trials, vaccine trials should be developed in our own country for the safety and accessibility of our population. So in this RCT or randomized control trial on any vaccines or any drug is extremely stringent, closely monitored in every hospitals. So there will be an ethical committee in the hospitals where these, RCTs or control trial trial is conducted. That will be monitored by the DCGI or other statutory body. So every adverse effect will also be monitored. It will be subsequently thoroughly examined. So this is the way how a randomized control trial is conducted in any country, including India. Now, once we have information about the phase 1 and phase 2 trial on these vaccines, also these two vaccines are now in the advanced stage of phase 3 trial. That means we have a lot of information. So which are already reported to the disease.
All right.
Cannot be known to the public. So now, based on this, in a background of pandemic situation, in a pandemic we cannot wait, because we are also waiting for the second wave by a mutant virus that is coming from UK or other countries. So if that next wave has to come to India, we do not know what is going to happen.
All right. Dr. P. Shyamsundar
Vaccine
Singh.
available must be given properly.
Yeah. So it's more or less clear. Dr. P. Shyamsundar Singh, if we talk about Manipur, have elaborate arrangements been made to tackle any emergency situation, especially at centers in remote districts of the state? We are not too worried about the Imphal districts because there are good medical facilities available. But as far as the remote centers are concerned, are proper arrangements in place?
Yeah, you're very pertinent and then very important question indeed. Yeah, we have chosen 7 district hospitals where we have ensured that enough manpower is available with the appropriate and then sufficient logistics to meet any eventuality in case of any untoward incident after vaccination. And for that, we have made sure that specialists are available in those areas where we have planned this vaccination in all 10 sites. And then, say for example, in cases where the person after vaccination, the beneficiary becomes serious, then we already have made those facilities available there. For example, intubation if it is required, which I don't think will happen, and then transportation and so on and so forth. And then the specialists, even pulmonologists, are made available in blessing all of us. We will be having no major issues. And then, as we have rightly pointed out, AEFI is a very important chapter in this vaccination process. But then we are mentally and logistically and manpower-wise, we are fully prepared now. The only thing is we are praying for God's blessing.
Dr. Nabuchuti Gogoi, in a way, do you think the situation is ideal? It's an ideal situation to go about the vaccination process, because the COVID situation in most states in the country is more or less under control now. If we talk about the Northeast, it's almost under control. If we say Assam, it's almost under control. I mean, if we recollect the numbers that used to be, and now we can safely say that it's completely under control in a way. So that way, there is no rush. People can wait a bit if need be, and that's perhaps an ideal situation, a perfect timing of sorts to go ahead with the vaccination process. It's a blessing in disguise because things are under control.
First of all, the thing is that it should have been much earlier than we should have been getting this vaccine earlier.
Of course.
We're going to get late. Anyway, whatever it is, now thing is that people are thinking it that way. If I tell you, suppose there are still cases, though the numbers are less, there are still cases, there are still people, those who are vulnerable. We have cases, those who had been positive about 45 days, still 45 days. We do have 2 or 3 cases out here. So this virus can harbor in any individual in an asymptomatic manner for a very longer time. So he can easily infect those vulnerable sections of people, those who are having hypertension, diabetes, those who are kidney disease or cancer patients. They might cause a sporadic outbreak here and there. So those vulnerable sections, there will be more fatality. Though the number will be less, there will be a number of fatalities, and death rate will be much higher. So those are the dangerous things that might happen. So for that, we'll have to eliminate this disease. Our motto is to eliminate this disease from the face of the earth. So this is such a dangerous virus, this is such a peculiar disease we have got, which have made the world, have shook the whole world and brought everyone down to their knees. So we need to wipe it out completely. To wipe it out is not only the herd immunity. So we can go for herd immunity by letting the infection go into the community, but there will be casualties. But if we go for herd immunity by vaccinating people, and that will be a better way of doing it, because there will be no less number of people, those who will die. 1 in lakhs or 1 in 10 lakhs may die due to reaction or something like that, or anything might happen. So that's a thing that needs to be worried. A very important thing, we'll have to look into it. I think it is a time, ideal time, and this vaccine has come out in such a period, in a gap of 1 year. So this is a commendable service. You cannot just expect a vaccine to come out in such a short time. And there has been a lot of trials that had been made. We have been through all those trials. We have seen those trials. We have in international arena, in a national arena, a lot of scientists are talking about it. So many people are talking about it, that it's a safe vaccine. So let's believe them. And we do have a competent authority in vaccinating people, because India, we have been vaccinating, wiping out polio and a lot of other diseases and vaccinating so many people. This vaccine is not going to cause any COVID-19 disease. You know, like these are they're structured in such a manner, 4 different types of vaccine: RNA vaccine, the whole virus vaccine, and there's some genetic coding vaccine. Those are genetically coded and triggering the immune system. While triggering the immune system, the body will react to the vaccine. So at that time, people might have some reactions, minor reactions, feeling warm, say a small fever or something like that. It might happen. So that should not go into the public in such a negative way. These are positive things. People are responding. That means someone having mild fever. That means that person is that the body is creating antibodies against the virus, against the spike proteins. So this is a safe vaccine studied by topmost scientists of the world, and we have experiences whatsoever in our country. We've been vaccinating for so long years in millions of people. So we have a system in place. I don't think, and there's nothing to be worried. I don't know why people are worrying about it. For me, it's just another vaccine.
With an open mind.
It will be very helpful for the
Absolutely. Let's go out there with an open mind. Again, Mr. Sampath Kumar, I've been asking these questions over and over again to my panelists, because this has made news in the last couple of weeks. But then, well, I'm sure starting tomorrow things will be put to rest. But again, do you think mass awareness drives will be necessary ahead of the 2nd and 3rd phase of vaccination to generate that confidence among the general public to come forward in large numbers to take the vaccine?
Yes, that's why actually, you know, we are working on that one. That's why we had a media sensitization workshop yesterday, explaining them, like, you know, the need for massive awareness, need for so basically that's very important, and that's why we have a proper communication strategy for it, and involving all the stakeholders who are important, you know, who can actually communicate this message, that, like, you know, this is why it is important, you know, why it is important to, you know, create that herd immunity, why it is important, especially to contain this, COVID, which is actually has taken a shape of a pandemic. So, and also that, like, it's the highest scientific body of the, the country has approved these vaccines, and, they are immunogenic and also safe. Yeah.
Also, and Mr. Kumar, any message you have for the people of Meghalaya on the eve of the vaccination drive?
Yeah. The message is that, like, we request through you and through the media that the state government is taking all the steps, all the preparatory steps, all the safety measures, to roll out this vaccine. And as we wish, as you all aware that, like, the Meghalaya is one of the states, which has been actually proactively contained the pandemic, to a large extent. In fact, we have still, we are one of the few states with low number of active cases. So that in fact that's like taking that spirit again, even for this, next is like, next. So far we have actually followed a containment strategy. So far we have followed, breaking the transmission chain of the COVID. So we have followed a lot of rigorous testing and rigorous quarantine strategies. Now actually it is a time actually where we need to move on to the next stage of prevention through this vaccination program, and I request all of you to participate in this, because it is actually very systematically is being rolled out, and with all approvals and with all safety measures.
Dr. Bhupen Mahanta, last comments. We're running out of time. Well, let's shelve all the negativity out for now. We are being practical, and let's hope that is the beginning of a new journey. From tomorrow, the vaccine is here. We can safely say bye-bye COVID in a few months' time, isn't it?
And with the available vaccines, probably there is a speculation that our Indian vaccines might even act against the mutated virus also. But we need to know some more information, maybe post-marketing or. And I hope this will be a big success for the country.
Let's hope it's a big success. On that note, thank you so much, Dr. Mahanta. Thank you so much, Dr. Navjyoti Gogoi, Mr. Sampath Kumar, Dr. P. Shyamsundar Singh, Dr. S. Jugindra. Thank you so much, all of you gentlemen. And let's hope that the vaccination process is a grand success, the world's biggest vaccination process, mind you. And we should be proud of our achievements so far. That's a wrap of Bottom Line.